Line over at GMH, Mai Habib, the hospital spokesperson. Good morning, May.
Good morning, Chris, Sabrina, everybody, Tomas, Jason.
Let's just go ahead and start with this global outage of WhatsApp, Facebook, and Instagram. Has it impacted at all any of the hospital's operations?
It doesn't necessarily impact our operations at all because we run on internal systems. So in terms of healthcare delivery, absolutely not. In terms of communication between staff, of course, right? We're all used to discussing in our WhatsApp group chats what needs to be discussed, or actually that's basically it through WhatsApp. So it has slowed down communication a little bit this morning, but otherwise we are rock and rolling here.
What do you guys do? Like everyone go to SMS?
Some people are SMS. We also have a Zoom healthcare platform, which we are actually in the middle of transitioning to anyway. So we were in between those two.
May, very, very tragic news last night as we had six COVID-related fatalities reported. I guess we'll just start there and then go into the census if you don't mind.
Sure, yeah. So of those six, I know two were at GMH, both last Thursday on the 30th. I know one was a 27-year-old who had underlying health issues, and a 62-year-old woman who was vaccinated and also had underlying health issues. We have repeatedly said that the vaccine is sort of one of our best tools right now against COVID-19. And then if you do test positive, obviously the monoclonal treatment to help you fight off COVID. There are breakthrough cases that come through, and what we're seeing and what all the clinical data is showing us is that even when there are breakthrough cases with people that are vaccinated, it's the people that have multiple underlying health conditions and comorbidities that end up unfortunately succumbing to the virus, which of course turns into disease. In terms of our patient count overall, we're at 170. We do have 33 COVID patients right now, which is a little bit up. We had 7 admissions overnight, and 9 people are in the ICU for COVID currently.
How many on vent?
7 ventilated.
The fourth floor education.
Okay.
Once again, the Pfizer booster vaccination for GMH.
What's that noise?
That's coming from her.
It's our background PA system, which actually, is also a relevant topic of conversation. She was just announcing that the Pfizer booster vaccine clinic is running right now. We are running our Pfizer booster vaccine clinic for all our GMH workers. We're also supporting GPD and GFD that are eligible for it. So it's running from Monday to Friday, 8 a.m. to 12 p.m. here internally at GMH. And, there's been a lot of uptake on the booster shots. So we're very happy about that.
Mm-hmm. Are you guys still doing the MAB, or is that strictly up at Manila?
No, we are still doing it. It's a very small scale operation that's really for ER patients. Any GMH employee that tests positive, and it's a way smaller scale operation than the Manila center. And also the Manila center, I believe, is not open on Sundays. And so if they have anybody on Sundays, or if there's a referral that needs to come in from a private clinic or GRMC, they'll also send them over on Sundays because we do run a 7-day operation.
And how's it been going now that you guys have had help from the DoD Medical Team?
So they just started in our rotation on Friday. They were orienting at first. So we had 13 of them go into the rotation starting, Friday, Saturday, and into the weekend and into this week. And then one more joined on Monday, and we're still waiting for the final because it is a contingent of 15. Of course, it's welcome, support, and relief. It doesn't mean that anybody here is working any less in terms of the clinical side, actually the entire hospital. It just is such welcomed relief and support, and it was much needed, and we're very excited about it. So they're in the rotation. We have them for 30 days. We are so thankful to our federal partners and DoD, of course. And like I said, there's one more that's expected. 30 days will take us until the end of October, and we are hoping to, obviously the biggest hope is that this wave sort of comes down, the surge anyways, but also that we would transition more into travel nurses. We would be able at that point to bring in more travel nurses to sustain our operations, because COVID really changes things for the hospital.
Mhm. Do you guys have any travel nurses currently, or no?
Yeah, we do. So in all, COVID staff, I checked in this morning before I jumped on this interview. We are at 41 travel staff, which is up because we had been hovering in the 30s for some time. I think I've discussed this with you guys before, the demand across the nation, the exponentially higher rates that continue going higher. If you're going to be offered the same amount or even more stateside, you would probably be more willing to stay close to family, especially coming into the holidays, Thanksgiving, Christmas, for these 3 months contracts, you'd want to stay closer to your mainland family and friends. So it has been difficult to recruit, but we've been doing everything we can. We've been working closely with our travel agency partners to try to bring in more. So a little bit more have come. Like I said, 41 travel staff as of this morning. And we're hoping that by the end of October, as the DoD staff shifts out, we're able to continue augmenting our own capabilities with travel staff.
Mm-hmm. And is there any update on the morgue situation?
In terms of bringing in the reefer?
Yeah.
That's still a discussion that's ongoing. It's still trying to finalize the materials coming here so that it can be built. So we don't have a final ETA yet.
Staph infections, is there an update?
Yes, the latest that I know of was on Sunday evening is the last. But again, a lot of this is community spread. When we discuss how our staff is getting infected, it's, their partner was positive, their kid was positive, they were in a family gathering where this person was positive. People generally are able to decipher. It's really rare when you absolutely have no idea where it is. If somebody around you has symptoms and then they test positive and then all of a sudden you have symptoms, you can kind of go from there. I've said this before and I'll say it again. Our infection control staff are completely on it. Employee health is on it. We have internal monitoring through Sarah Alerts. So we're actually even catching people through that. So every day, every GMH staff is required to monitor their symptoms and report their symptoms. So if people are reporting cough or sneezing or sore throat, or we have a list of different symptoms that we can go through. Our employee health staff and our infection control staff follow up right away. They ask you to quarantine. They ask what the situation is. They get tested. So the staff to staff infections are so minimal, even when somebody does become positive, because right away they're quarantined until they're tested and then they come back.
Right. Well, I think that's it. You always do a thorough job. With letting us know everything that's going on at the hospital. But I did just also want to take the moment to just say thank you for opening the doors to us, to allow us to go behind the front line and meet some of the heroes up there at GMH. And we really do appreciate the opportunity that you provided us, and just really the hard work everybody is doing up there at GMH.
We appreciate you so much, and we appreciate the series. I know it's making a lot of our people really proud to see that, they're represented, and people in the community are starting to hear the real stories from GMH, because people don't always know how much is being done here. So thank you. Thank you for sending your team, and thank you for going behind the front lines.
Thank you, May.
Thanks, May. Stay safe.
Right on. 9:01. Let's take a quick break, and we're coming back.